about the full name and what it stands for?
So Imua means move forward or moving forward in Hawaiian. And our full name is Imua Orthopedics, Sports and Health. And we're both sports medicine doctors, and I'm an orthopedic surgeon. And as an osteopath, she deals with the musculoskeletal, so that's also orthopedics. But then we're also very much proponents of health, and we really wanted the word health in our title, so that it's not that we're focusing purely on injury or illness, but instead actually health and vitality.
Would you each explain to me what your specialties are?
Sure. I'm an orthopedic surgeon, and my subspecialty is knee and shoulder and arthroscopic surgery. And so that's surgery on bones, joints, muscles, ligaments, tendons, injuries from sports.
So for me, I'm actually a family medicine trained sports medicine physician. So what that means is I'm not a surgeon, but what I have is more the breadth of looking at the whole patient from not just a sports medicine musculoskeletal perspective, but also all of the other aspects of nutrition, diet, health, lifestyle, and more of a basis of chronic medical disease can be helped through an osteopathic type of approach, which looks at the whole body and how to help the body work more efficiently. But so much of it also is prevention, and a lot of that can come from physically helping the body be stronger so it can be more resilient to prevent physical injury, but also nutrition. The food that we put in our body is the fuel that helps us rebuild when we're trying to work out or reach certain goals. So I think one of our greatest strengths is that we're not the same type of doctor.
The reason why we're complementary is actually, as much as I'm a surgeon, I don't believe surgery is the answer for everything. I'm very much a proponent of non-operative means of a patient getting an athlete better, and Dr. Giesig is so excellent at her expertise.
You can have the kneecap move around, and sometimes it can move so much it can pop out, but not you. Very good. It feels good. Bend your knee hard. Oh, very good, very good.
You gave me a hug.
Starting a business in Hawaii is never easy, and when you manage that with juggling the costs of healthcare and insurance and everything, how has this journey been for you?
It's definitely a learning one, right? So in medicine, they do not teach you anything about business, right? So they always joke that doctors make the worst business people.
With business, there can be like a singularity of purpose, right? What is that bottom line financial? And the truth of the matter is we don't really see it that way. You know, there's the double bottom line, right? There's, of course, we need the business to succeed and prosper, but with that, we're not perfect, but we try to be led by the right intentions and the right mission and the right purpose, and giving back, well, then that's successful doubly. So that's how we try to look at it and remind ourselves.
For us, it's not just about clinical medicine, it's about getting in the community.
I like being that example actually for both of my kids, not just my daughter, in terms of not living life for oneself or just what one wants, but there's always service above self. And ultimately, you know, as physicians, we're not just here to bring patients here and take care of them here, it's to bring health and vitality out to the community.
So how do you find time to do all the things in the community that you do? I know you're on a number of boards, you help many nonprofits. How do you fit all of that in there?
How we're able to do it, how I'm able to be on these boards is tremendous support. And I consider walking in through the doors of this office a second home. But actually what makes me most happy and content is the staff that we have here. I think that the environment that we've created and they've created and perpetuated, patients comment on that all the time, of the warmth that is obvious amongst the staff, but then that translates to the experience that the patient has. And so
we spend sometimes more time with each other than not necessarily our own families, but you know, we could not do it on our own. Heaven forbid, we would be terrible at all the other aspects that really make Imua. But their love, their passion, their dedication to not just the mission of Imua, but to our patients, that's the family of Imua that really just allows us to see the growth and just the love and pure the joy to get, come to work on Monday, definitely. So because there's 4 pillars of health, sleep, stress, nutrition, as well as movement. And so many times people think they can be eating all the right foods, but if they're not paying attention to those other 3 aspects of their life, we have to think of the totality of our health, not just ingredients of our health. We tell our patients every day, it's not about perfection, it's about progress. So in telling our patients, and working with them, it's more about what are the little choices that I can make every day in those 4 categories that can get me closer to reaching my goal.
it's not where you are, where you stand, it's in the direction in which you're moving. And again, that really speaks to our feeling of Imua, meeting our patients wherever they are on their journey and moving forward with them. It's not about calorie counting, it's not about portion size on the plate. For as scientific and health-based as we are, we're so much more holistic than just the black and white numbers of your vitals or lab values that we see in your chart.
Nutrition is prevention, really. It's a way to make you feel better from the inside out, rather than just throwing a pill on the symptom. With nutrition, we can correct the issue at the most fine and minute level so that you feel good.
To have the opportunity so young in my career and right out of fellowship to learn and be around someone that you are motivated by and who sets a great example, to that to be day by day learning from them as you go, but to see how much you can do when you're led by the right intention, that really every day touches my heart, but also makes me want to strive to be more than just a doctor in a clinic. It's a wonderful opportunity to be surrounded by people you want to be like, right? So.
Oh, and she's being very humble. So Dr. Giesek grounds me, and she is living proof that you can be inspired by someone younger than you, and she certainly inspires me, and she sets the standard to which I try to live. So she's being very humble as well.
So do you have any advice for young entrepreneurs or maybe even females who are thinking about branching out and starting their own business, following their dreams?
Whether they're female or whether even for males, I think the singular thing that I can say is be purpose-driven. Financially, things will come. I think if you are led with the right intentions and the right purpose, everything else will succeed. Also, measure how you define success, and that's different for everybody. One person's treasure is different from others, but if by that treasure you define what your mission is and you're led by that, as opposed to just the black and white bottom line finances, it's hard not to succeed. And when you have fun doing what you do for work, it's not work anymore.
The true mission of our business is to make people's lives better. And it's not just because you tore your meniscus and your knee is sore, because we don't want to just touch one aspect of our patients' lives. They really become the reason why doctors become doctors. And it really isn't anything that we're doing, but just creating the space, the desire, the opportunity for that person to literally come alive. And that, I think, is what creates so much joy and really why we love what we do and love our patients, because we couldn't do it without them, right? They're the ones really doing a lot of the work when it comes down to it.
Let me tell you, the people and the patients of Hawaii are the most loving, the most gracious, the most kind people, and truly warm, and that's what gives me joy, is walking into the room, knowing a little bit about not just the patient but their family, talking story. That's what makes a good clinic day.
Your shoulder's finally better, so you can start playing on Saturday.
Yay!
Thank you.